Right, there are some things out there on hospitalization rates. We only know what we know from our data in Ohio so far, which I still feel is insufficient data to firm it up, but we're seeing a fairly high hospitalization rate. And we're seeing some younger ages being hospitalized, not necessarily dying, but needing hospital resources. So the modeling, I think there'll be a day, or maybe it'll be a side video we do. I'd love to really dig deep in the science on this for people. This modeling has a lot of assumptions, so people always say that about assumptions, but they've been very useful assumptions. They are a compass. They're never exactly dead on, but they definitely give you the sense of directions you need to take. And so when I say, I didn't need this modeling, I said words to you probably a month ago now that would have predicted exactly what we're seeing now, and I had far less data then. Because some of these things are just inherent in the nature of what we're seeing with this infectious disease as it unfolds around the world. But the modelers will argue, and it is great fodder for TV, but the gist of it is, it's based on two assumptions. One is about, some assumptions about the mitigation strategies, those non-pharmacologic interventions, which have been fairly well studied, but it's very variable based on how we human beings adhere to them. So there's variability built into that. On the other side, there's something called SIR. And if you remember, I told you about I believe it was a Washington Post graphic model, and dig it up again for viewers, but it was showing us all 11.7 million Ohioans as dots. And it's based on theories of how diseases spread and how quickly they reproduce and how susceptible we are to them, how infectious they are. The R naught you hear about, one person doing 2.28 people from each infected person. But you have S, I, and R. S is susceptible people. That's someone like me who has not yet caught it. You've got your I's, your infectious people. And then you have the people who have recovered, who have recovered from it and are no longer infectious. And what we're seeing so far, again, remember, what we learn every day and the science changes, but the people who are now recovered, we're seeing some sense of immunity, at least for a while. And so therefore, they're not going to be giving it to someone else. And it really is a statistical modeling that is based around millions of points of data. And, but you don't have to take my word for it. You can just watch what's happening on the streets of the world, and that pretty much matches the modeling.
Do we have a number of recovered patients?
I don't think we'll have an accurate number of that. We can talk about based on the date of onset and the 14 days, and you can look at the cases we have. But as I've told you, I've seen drastic numbers about how many more cases there are than are being tested for. We know we're only testing the tip of the iceberg. We know many, many people have had this disease. In fact, if you're having this disease and you can't be tested, you're hearing from your doctor to assume you have it and stay at home. And they're helping you ride it out. So to say who's recovered or not when we have no way of knowing what doctor has talked to what patient and if they've recovered, we just don't have anything like that yet. I do have hopes. There'll be new modeling and different types of statistics done once we have serologic testing. There'll be other information that we'll do on sort of mass surveillance of asymptomatic people when we have the testing that will help us get some guesstimates on that. You'll never know every single person, just like we never know every single person who has the flu, because not everyone who has the flu is tested for the flu or everyone gets treatment for it.